Hey y'all, let's talk about 5 ways to prepare for pregnancy and optimize your health. My name is Dr. Fatu Forna. I am an OBGYN who works to keep pregnant women safe here in the US and around the world. So Black women, you gotta be ready to fight to survive in these here United States of America when it comes to pregnancy. It's like it's a war zone for pregnant women, Black pregnant women. You gotta fight. But you can do that. You can, most maternal deaths are preventable. You can do that by making sure you are in the best of health when you get pregnant. So how do you do that? Let's talk about 5 things you can do. Number 1, optimize the age that you get pregnant in. Optimize your age. What do I mean by that? When it comes to getting pregnant, we don't want you to get pregnant too early or too late. So not too early, not too late. Yeah, we don't want you to get pregnant when you're a teenager and 15 or 16. There are risks associated with that. But we also don't want you to get pregnant too late either. I've talked before about how getting pregnant for a Black woman, if you get pregnant at age 40 plus, you're 15 times more likely to die than someone who's younger. So the early 20s is the best time to get pregnant. It might not be the best time or perfect time in your life, career, partner, all of that. But if you are able to make it work and find the things that make it right for you to have a baby, the early 20s are the best. The 40s, not so much. And the reason is because in your early 20s, you have the best fertility, you get pregnant easily. You are less likely to have hypertension, diabetes, obesity, heart disease. Your stress is not as bad. And all of those things can increase your risk of death and bad outcomes. All right. So age. Number 2, optimize your weight. A lot of the problems that come with pregnancy that lead to bad outcomes can be compounded or made worse by weight. So make sure if you're planning to get pregnant, you're exercising, you're losing weight, keep your weight low. Black women actually have the highest rates of being overweight and obese in the US. 80% of Black women are either overweight or obese. So if you know you want to get pregnant, work on your weight and try to keep it low because you don't want to enter pregnancy already overweight or obese. Those things can lead to a higher risk of dying. Number 3, optimize your blood pressure or hypertension. All right. If you have hypertension, make sure it's well controlled. See your doctor before you get pregnant. Make sure you're on the right medications. Let your doctor know, I'm trying to get pregnant. Make sure you put me on medications that are safe for pregnancy. Ask that question because there are many blood pressure medications that are safe for pregnancy. Hypertension increases your risk of something called pregnancy-induced hypertension, preeclampsia, gestational hypertension. Those are things that are the number one killer of Black women in pregnancy. They can cause you to have seizures, strokes, heart attacks, and die during pregnancy. So the better control your blood pressure is, the less the risk of those things. So make sure your blood pressure is controlled to reduce your risk of maternal morbidity and mortality. Number 4, optimize diabetes. If you have diabetes, again, see your doctor. Tell them you're planning to be pregnant. Your blood sugars need to be very tightly controlled before you get pregnant. When you get pregnant, if your blood sugars are really high, something called your hemoglobin A1C, which measures your blood pressure sugars, if that's really high, it can cause the baby to have heart defects and other defects. You don't want that to happen. You can tighten your blood sugar control, and that's going to help with pregnancy. So also any other chronic medical conditions that you have, see your doctor. Make sure you're not getting pregnant unless you're ready to get pregnant and that all of those illnesses are under control. And then number 5, take prenatal vitamins. Prenatal vitamins are critical before you get pregnant. By the time you know you're pregnant, it's too late. Those prenatal vitamins should have been in your system because the baby's organs form very early and you need something like folic acid, which is in prenatal vitamins. It reduces your risk of spinal cord or neural tube defects, cleft lip, palate, some heart defects. So it's critical that you're taking those prenatal vitamin if you're planning to get pregnant. So, exercise, decrease your stress, get your mind and body prepared. So if you're planning pregnancy, start getting prepared now. Get your mind ready, get your body ready for pregnancy because you're entering a war zone. We need you to fight to survive. We need you to survive and thrive. All right? Bye, guys.